Welcome to another episode of Voice of Rio Grande. I'm Dr. Donna Mitchell, Dean of the College of Professional and Technical Studies, with my co-host, Dr. Heather Duda, Dean of the College of Arts and Sciences. Hello, Heather.
Hello, Donna. How are you?
I'm great. How are you?
I'm doing well. Are you enjoying the heat wave we seem to be experiencing?
The hotter, the better.
I'm the same way. Have you gotten out on the water? I know that you do enjoy some water activities.
The closest I've gotten to the water is my pool.
That's a good place to be during this weather.
Sometimes I come home from work and just jump in the pool to cool off a little bit.
I'm envious.
Like anytime, come over. It's always open. It's a beautiful day on campus. Everything is just in bloom, and it looks so nice, and the grass is all cut so pretty and trimmed, and it just makes me happy to be a member of the Rio family.
Me too. And do you, I don't know, over in Mackenzie, have you been hearing the marching bands practice?
I have, and actually when we walked in this building, I said, "What is that?" and walked around and realized that it was one of the groups from the band, a small group, and they were playing in one of the rooms, and it was actually very pleasant to hear.
It is. It's really nice, and the bands sound great. I mean, they sound ready for the field to me, but I'm no expert when it comes to marching band. And then it's been fun watching some of the marching, the beginnings of sort of their routines, because they do them in the parking lots, and so I've been enjoying listening and seeing what they're doing.
I remember those days. I was one of those band campers years ago. I sure was. And the camps, I've watched the girls and the boys basketball camps, and it's been fun to watch them out there playing basketball. And then you see the Rio t-shirts throughout the community as they leave the camp because they purchase t-shirts. So that's always fun.
Absolutely.
Well, we are very, very fortunate to have a special guest with us today, and that is our brand new director of our School of Nursing and also the chair of the School of Nursing, Dr. Bonnie Allen Smith. And Bonnie Allen Smith's first day at Rio was Monday.
Good morning.
Welcome, Bonnie.
Good morning. How are you?
Good morning. Nothing like having you start on Monday and having you on Voice of Rio immediately.
Oh, I'm thrilled to be here. Thank you for inviting me.
Well, we appreciate you being here.
Absolutely.
Tell us a little bit about your past, Bonnie, and maybe what brought you to Rio Grande?
Well, I was born near here in Athens, Ohio. I'm the oldest of 5 children, and born and raised on a farm. We had dairy and beef cattle, and my father loved the farm life, and my mother's a teacher by trade, and just really look forward to being part of the Rio family and building on the excellence upon which the school was founded.
Wonderful. Well, we were very excited when you decided to be a part of our family. Can you tell us what maybe drew you to Rio Grande, or why did you decide to apply for the position?
Well, I graduated from nursing school many years ago in 1979 with an associate degree, and as the oldest of 5 children, my youngest sister is 15 years younger than I am, and so I wanted to be able to get home and visit her and see her sporting activities in Albany, and I yet wanted to also be on my own and be independent. And the local hospital here paid $6.25 an hour, which seems very low in today's environment, but that was one of the higher salaries in the area at the time. And so I relocated to Gallipolis at that point and worked in the medical surgical area, worked in the critical care units, did some float nursing because I knew education was something that I would eventually hope to be a part of, and come to love the area with the river, and there's nothing more beautiful than the 4th of July fireworks over the Ohio River. So just happy to be back in this area and meeting and working with people in the community.
Well, we're happy to have you. You mentioned that you did float nursing. Could you tell us a little bit more about what that entails?
Float nursing is an opportunity for the nurse to arrive to work, and wherever the need is, the nurse would then be assigned to that unit. So I had an opportunity many times to work in the emergency room or labor and delivery, so I would to see the babies be born, work with the new parents. Had an opportunity to also work in the orthopedic unit, critical care unit with the patients who had had heart attacks or myocardial problems. Worked in the intensive care unit, found that critical care was truly my love, and that's where I spent most of my career as a nurse. And I continued to work at the hospital as I advanced my nursing degrees until I started my Ph.D. program. And at that point, I had to step back a little bit and devote most of the time on the weekends to study, because we had cohorted degrees in higher ed administration. So I was not as active within the nursing hospital realm at that point.
Wow. So where did you earn your doctorate?
My doctorate is from Ohio University in Athens. It's in higher ed administration. My master's degree from Wright State University in Dayton, Ohio. And my bachelor's was from Ohio University as well. So, local girl, come back to the area.
I hope you've been well received since you've been at Rio. You've only been here 3 days, so it's a little hard to tell yet what it feels like. But as a brand new person on campus, you're meeting a lot of new people. I hope you're feeling welcomed.
Oh, everyone has just been wonderful to meet and work with, from the housekeeping staff, the students. Everyone's very pleasant, says good morning, asks me how they can help. And I've been eating at the Subway here in Rio Grande, and the gentleman yesterday said, I really need to know your name because you've been here 2 days in a row. And so we struck up a pleasant conversation, and he was telling me the time of day to come and eat so that I would be able to get back to my meetings and things as things get busier in the autumn semester.
And you know, that's, I think, one of the things that makes Rio Grande so special. Years ago, our motto was Rio, where everybody knows your name. And it is true that as you walk across campus, people will speak to you by name. We know our students. Typically, we know the majority of our students by name quite quickly. Our classes are small, other than nursing. Nursing classes are larger, but I believe they have smaller clinicals. Is that correct?
The clinicals are usually the opportunity for the students to gain that hands-on experience that makes them the valued employee when they graduate and walk out our doors. And usually our clinical ratio would be 1 instructor per 8 students, 10 maximum, but it's nice to have that 1 to 8 ratio because that provides more opportunity for the clinical instructor and the student to learn the profession of nursing.
And I would think that would also give the faculty member an opportunity to get to know the student quite well.
Oh, it does. I think it's essential that the student and the faculty member develop that relationship. It's an opportunity for our faculty to role model professional nursing. It's an opportunity for the faculty member to recognize the strengths that the student has, and if there are any areas that the student and the faculty member determine would be good for improvement, there also is a way to then work on those skill sets to help maximize their time in the clinical setting.
So you talked to us a little bit about why you came to the area, but was there anything specifically about University of Rio Grande and Rio Grande Community College that was appealing to you when you saw the ad?
I think when I was reading the ad, I was reminded of the excellence, the foundation that this institution was built on. Rio Grande is a teaching-centered institution, and that's very important. And knowing the nurses who have graduated and work side by side with nurses who have graduated from the Holzer School of Nursing, I know the excellence in their skill set, and I know that the faculty members have a passion for what they do, and they bring that passion into the classroom, and they're able to utilize active learning strategies, and they're able to share real-world experiences that help make the Holzer School of Nursing graduate one that is very valued by employers and our advisory board members across the area.
It's so nice to hear that, because, you know, we know that that level of passion and commitment is happening inside the class because we see it every day. It's nice to know that that is also the perception outside of the institution, because I think our faculty really a lot of times go above and beyond for our students to create that positive learning environment and that hands-on learning experience so that our students are successful in whatever they do.
I think that the faculty here are very committed and very dedicated to student success. Having just gone through an interview process, I can attest that they were very informed about the kinds of questions that they would want to ask a leader. And they were very clear about their expectations for maintaining accreditation of their program, which is critical to the ability of the student to graduate. And they had that passion for what they were doing. It was very evident in the room as they introduced themselves, as they were asking their questions. So putting that together with what I knew from the community really helped me to recognize that in this next phase of my career, I wanted to be here at Rio.
That's really wonderful to hear. I do see those faculty frequently because they're in my college, and they do almost feel like their students are their children sometimes. They take ownership not only of the program but of the students, and many times our faculty go above and beyond what you would expect a faculty member to do, whether it be help a student who's struggling financially, help a student find transportation to a clinical. Sometimes I feel like we're faculty members, but we're parents on this side because we worry about our students and want them to be successful and want to try to help.
I think that student success shines through in everything that I've seen thus far here, from our support staff members, nurturing the new student, to the dean, welcoming everyone. I think it's very important that we continue that level of excellence. And one of the things that struck me yesterday when I was meeting a couple of faculty members is they were talking about celebrating the successes at the pinning ceremony that's coming up in August. And I think it's the 11th, is that right? And the opportunity to share in that success and to actually go back to the true roots of nursing, that Florence Nightingale was the first to actually utilize the nursing pin as a symbol that that nurse had the skill set to take care of patients. And to be a part of that pinning ceremony is just really exciting.
That's great. Well, we're going to take a little break here. We've been talking with Dr. Bonnie Allen Smith, the director of the Holzer School of Nursing, and Dr. Duda and I will be right back. Welcome back to Voice of Rio Grande. I'm Dr. Donna Mitchell, along with my co-host, Dr. Heather Duda, and we are very privileged to be talking to Dr. Bonnie Allen Smith. And welcome back, Dr. Smith.
Well, thank you. It's nice to be here.
I would like to ask you a little bit about your experience in nursing education. Have you ever taught a nursing program? Have you been a director before?
I come to Rio with many years of experience. 38 years as a registered nurse, and had an opportunity in 1990 to join the staff of my former alma mater as a faculty member. And so at that point in time I did clinical instruction, did their transition course from the LPN to RN program, and worked to enhance that particular program. Also worked with associate degree students for a number of years in their final semester of the associate degree program. And then as I got my Ph.D., I became very interested in the world of assessment. And so I was fortunate enough to have an opportunity to represent the college as the institutional assessment director for student academic achievement, and did a lot of traveling, a lot of presentations, and became very involved with institutional assessment from about 2006 through 2012. And at that point I was recruited by the president of the college at that time to return to my roots, if you will, and became the dean of allied health. And so under allied health I worked with medical assistant program, the physical therapist assistant program, health information management, massage therapy, a lot of the biological science kinds of programs. So I was able to have a wealth of knowledge there, working with those faculty. Really valued that interdisciplinary approach. I think that's so critical, and I think we'll have that opportunity here at Rio to work together as the new simulation lab comes on board, and the students will have those hands-on experiences in the real world setting, but yet it's a practice environment. So I'm excited about that. In 2014, I became the dean for the Health and Safety, Allied Health and Nursing Division at the college, and held that position as nursing program director when I left just a few weeks ago. So happy to be here.
You have a wealth of experience
Absolutely.
to bring with you.
Well, it's been a wonderful journey. I value my nursing career and look forward to contributing to the growth of Rio Grande.
You mentioned a pinning ceremony coming up on the 11th. What type of students will be pinned? Will it be the BSN students, the RN students?
Typically the pinning ceremony is for the students graduating and moving into the career as a registered nurse. And so those students graduating this term will be the licensed practical nurses who have been part of the hybrid program, which is mostly an online program. So we're really excited to be able to share in the excitement of their new journey. They'll be eligible to sit for their licensure exam to become registered nurses in the very near future. So we're excited to share that evening with them and their families.
It sounds like a lovely day.
It's always exciting. How many programs are available in the School of Nursing? What kinds of programs do you offer?
We have 3 programs at the present time. We have an associate degree program, which is a 2-year program that would enable the student upon successful completion to sit for their national licensure exam to become a registered nurse. We have an LPN to RN program, which is a more traditional classroom format that's held on campus, where the student comes to campus and has the content delivered by faculty. And then we have the hybrid program that I just mentioned that is typically an online type program for those students who are licensed practical nurses and are advancing into their associate degree level. And then we also have our baccalaureate program, and we're very proud of all of our graduates. They have truly a commitment to help serve the community as members in the healthcare profession. So we're excited to welcome them in as registered nurses.
You mentioned that one of the interests you had in your career was with assessment, and assessment is something we all talk about a lot in higher ed. Can you tell us a little bit about why assessment is valuable, why we do assess programs and courses?
I think it's important for us to know what we're doing well so that we can then enhance those skills in our students, and it's also important for us to recognize if there are areas where we can improve. And so when I think of the world of assessment, I think of it as being able to close the loop, if you will, to actually, I see it as a circular motion where we're actually taking in information and we're gathering all of that information, then we analyze it, and then we're able to determine, if you will, or assess our strengths and assess areas for improvement. And that enables us then to build stronger and stronger programs, which will enable our students to be more productive when they enter the workforce.
I think that your explanation is wonderful, and it's exactly what assessment should do. Mm-hmm. And so I'm thankful for having yet another person on campus with such a wealth of assessment knowledge to help us all get better.
I'm excited to be here.
You talked about the simulation center briefly. I've noticed the construction on campus, and it looks like it's coming along. What will be happening in that building when that's completed?
Once the simulation center is completed, we'll be certainly involving the students and the campus community in the grand opening, and we hope to have a shower, I understand, and invite people in to see our new facility and share in the excitement. The students will have an opportunity to practice their clinical skills in a setting that is totally safe. And so we'll be able to set up simulations of different patient care situations and change the environment so that students can actually experience what it would be like when a mother gives birth, when a patient is newly diagnosed with a health alteration. We'll be able to determine if there are ways that we as faculty can help the students with those hands-on experiences so that the real life experiences will be much easier for that student. We commonly do things in this practice environment that might mimic an emergency situation where the student would be involved in a mock code situation where the patient's heart has ceased or their breathing has stopped. And so the student gets to practice all of the different skills that they need to help hopefully bring that patient forward and into a better environment.
Are there ways that the campus community, those outside of the health professions and the health field, ways that we can help ensure the success of the simulation center?
I think that certainly all of us will need to work together for the success of the center. I see it as being an interdisciplinary center in the future so that all of the different professions in the health field would work together, but we look forward to bringing in our alum and members of the community to participate in different activities that might be going on at the center. We're going to need the support of the community to help make sure that the equipment is exactly what we need as we want this to really replicate what is seen in a healthcare facility.
We have had a skills lab in the past at Rio Grande, so if we have a skills lab, why do we need a simulation center?
The simulation center actually utilizes high fidelity and moderate fidelity mannequins, and these mannequins are very lifelike, and so these mannequins will enable the student to truly experience what it would be like to take care of a patient in a healthcare setting. The faculty will be able to set the patient's heart rate. They will be able to change their blood pressure. They'll be able to make the patient cough. They can make the patient stop breathing. The student is able to monitor vital signs. They're able to do everything that they would do in a real-life clinical setting. Our nursing skills lab is a great place to actually model the future skills that are needed, but the Sim Center is going to provide a much more lifelike environment for them to practice.
And I know you're using models. Will you ever use, for lack of a better term, actors as well?
Some of the centers that we have talked with actually use actors, and so we may be looking for some folks who have the ability particularly to talk with students, and so you can learn how to role play different events that may be happening in the healthcare setting. So we look forward to that opportunity.
Sounds like a world of possibilities.
Yes.
So Bonnie, this might be an unfair question, but I'm going to ask anyway. As you've been here for 2 days, basically, what's the most exciting thing that you see on the horizon for your career at Rio Grande, for the students and faculty and the nursing program?
Well, I think the most exciting thing right now is just the opportunity to meet new people and to move the students forward towards their success, because it's so rewarding to bring new nurses into our profession. Certainly the Simulation Center is a very exciting part of what we're doing, enhancing our accreditation, making sure that everything is in place. All of those things are very exciting to me as we move forward. Just thinking that we want to follow the strategic plan that has been set for the university and make sure that we're meeting all of the accreditation standards of our nursing professional organizations. So we have the blessing of having a strong program, and the associate degree program as well as our LPN and baccalaureate programs. And so we're just continue to build on that excellence and continue on to future development that will lead us to where we need to be in this century.
And just as a point of clarification, when you mentioned the LPN program, does Rio Grande offer an LPN program?
When we talk about the LPN, I'm speaking of those individuals who already come to us credentialed with the licensed practical nursing degree, and they're going to be transitioning then into the role of the registered nurse. And so we have both the online hybrid program as well as a traditional program to ease them in that transition. Some people call it a bridge, and it's like a bridge from one part of the profession to the next. And so we're excited to be able to celebrate the different milestones of being a registered nurse, and then on to the baccalaureate level.
And you mentioned accreditation. Are all the programs at Rio Grande accredited in the nursing program?
We are accredited by both the Ohio Board of Nursing, recognizes our program, as well as ASIN, which is the
Accreditation Commission for
Educational
Nursing.
And ASIN is in Georgia, and I had an opportunity a year or so ago to visit their headquarters and to sit in on some of the program administrator self-studies and make sure that all of the standards are in place across the nation. That organization strongly supports nurses and wants to make sure that the nurses that are providing the healthcare services to our communities are doing the very best job that they possibly can. And so we're fortunate to be fully accredited by the ASIN organization.
Okay, well, thank you for joining us today, and thank you for joining us for another episode of Voice of Rio Grande. We'll see you next month.